Our health is intimately linked to the social and economic conditions in which we live. These conditions are shaped by political, social and economic forces and can create or destroy our personal health and well-being. People further down the social ladder usually run at least twice the risk of serious illness and premature death as those at the top. Socio-economic problems are now seen as health problems that must be addressed to ensure everyone has an equal chance at a healthy life. Social determinants of health include the social gradient, or where we find ourselves on the social ladder, unemployment and a lack of job security, the type of transport available to us, early life experiences which start before we are born in the form of support received by our parents, social exclusion, poverty and discrimination, the amount of control we have at work, addiction to alcohol, drugs and tobacco, stress both at work and in everyday life, the type and quality of food to which we have access, our network of social support at home and in the community. This film follows the work of 3 groundbreaking projects in Scotland, Denmark and Slovenia. In the northeastern corner of Slovenia, a modest health revolution is taking place.
We are now witnessing the biggest change in people that happened in the last decade in the Pomurje region.
Murska Sobota is the capital of Pomurje, the poorest region in Slovenia. A public health initiative developed here in 2001 is addressing several important social determinants of health, as it targets the diet and lifestyles of people in rural communities across the region.
The objective of this program is to improve the health status of the population and prevent the development of chronic non-communicable diseases.
The program is called Let's Live Healthily. It was started when Dr. Belovic and other public health experts identified problems with the health of the local population. Mortality rates were the highest in Slovenia, as were levels of heart disease, diabetes and obesity. A lack of social cohesion and high levels of stress were also identified as causes of ill health.
The local population has been dealing with agriculture for many years. In the course of the last decades, this has changed since many found employment in factories, in enterprises, and the way of life on farms has changed due to more machines used, due to television. Cars have brought many changes to this area. These changes are rather negative, so people didn't hang out together any longer.
The public health team identified a traditional diet high in animal fat and salt, combined with a sedentary lifestyle, as prime factors affecting health. In 2001, the team set up a series of health workshops in 8 local communities. By approaching the problem on a community-wide basis, the program directly addressed the social determinants that were having a detrimental effect on health. These workshops were so popular that they quickly spread to villages across the region.
The continuation of the project has been ensured by the local communities themselves. These are things that were quite impossible years ago. There have been major changes taking place as social norms have changed.
The workshops are successfully bringing communities back together, as well as communicating the health messages.
Please don't cry, don't cry. The onion isn't too expensive, so don't cry over it, please.
There have been some unexpected social benefits as a result of introducing the program. In a nearby village, an unused patch of land has been turned into a communal herb garden.
The whole of the community works together in this garden. Before this project took place in Bogojina, everything was sort of dead and quiet. But now that the project was started, people get together here and they work the garden and then they sit down and chat. And in a way, this is a way of social gathering. It's something that's really fantastic.
An integral benefit of all these activities is that they directly address stress, another key social determinant of health.
Since stress is a major factor in health, this is one of the topics that was already included in our program. We wanted our participants to realize how stress would influence their lives. Every activity that we organize includes aspects that work against stress, such as singing or laughing, things like that.
There's one aspect of the Let's Live Healthily program that has really drawn people together: the community walks.
It was 6 years ago that we started with these intense activities within the program of the Institute for Public Health of Murska Sobota, and this eventually grew into a movement at the local level. So every Sunday we hold community walks and we go to different places. Even up to 200 people would turn up.
The community walks were originally designed as a simple and inexpensive way of encouraging people to exercise more. But there are major social benefits for the communities taking part.
Well, apart from living a healthy life, you're right to say how important it is to bring the community together. It is important that people meet one another. It is also important that they meet with people from outside of our community.
Driven by the communities themselves, the scheme has now spread to more than 50 villages across Slovenia and even over the international border.
There is much interest for our program in our neighboring Croatia. We are actually very near the border, and people living next to the border from Croatia have been joining many activities already.
The long-term commitment to the Let's Live Healthily program is a strong pointer to its success, and the health indicators of the communities involved are already showing measurable signs of improvement.
This program has been successful because it is a continuous program. It has lasted for 8 years. It has come from the local level, it is for the local level, it is quite appropriate culturally wise, and last but not least, there has been great enthusiasm of all of us included in the program.